My name's John Ferris. I'm the head of the program of ophthalmology in the southwest of England. I think the instrument is crucial because no matter how skillful you are, if the instrument hasn't been thoughtfully designed, even in the best hands, you'll end up with a suboptimal result. So I would say, it's probably 7 for score for the surgical instrument and 3 for the surgeon. Anticipating the problem is the first thing. So teaching the trainee to identify when there might be a problem, telling your theatre staff what equipment you might need beforehand so it's ready, informing the patient that you might need to carry out some extra manoeuvres, and if you've thought of the potential areas there may be complications, it makes the case smoother rather than being in a panic during the operation when you haven't anticipated there's going to be a problem. My favourite micro instrument is I do a lot of paediatric cataract surgery, and although the Malugan ring can be used for that, I do like the Iris hooks for just making it slightly larger in small children. And I've in the last 2 years had a lot of patients who've had a zonular dialysis because of trauma. They've been boxers or rugby players. So to use the capsule retractors in a segment of the capsule has made a big difference to the safety of the surgery. When it comes to pseudoexfoliation, again the pupil is often small, so I often use a Malugan ring. If you notice that during the capsulorhexis the lens is already starting to appear mobile, I'll put in a capsule retractor at that point. So hydrodissect gently, put in maybe a couple of the capsule retractors to support that, and then try again gentle phacoemulsification, minimal rotation. When you're cracking the nucleus, crack sideways so you're not pushing posteriorly. Careful with the INA, and if necessary, before putting in an implant, a capsular tension ring may be required depending on how many clock hours of zonular dialysis there is. But again, it's just recognizing A, that they've got pseudoexfoliation, B, taking the steps to stabilize the capsule right at the start of the case, and not waiting for it to extend. Those would be my tips for managing that sort of case.